Hello, in this video I'm going to talk about airflow in the lungs. We can actually do a mathematical calculation to determine airflow in the lungs. So if we do that, the letter F is representing airflow, and F equals change in P over R. Yay, what does all that mean? Right? So let's first talk about what airflow means. Airflow is the amount of air coming into or going out of the lungs. In other words, it's the amount of ventilation that is occurring. What determines airflow ultimately is the pressure difference between inside the lungs and the atmosphere, and then resistance. How much is the body resisting that airflow? More pressure difference between the lungs and the external environment causes more airflow. More resistance causes less airflow. Let's take a look at these two things. As we just said, the change in pressure is one of the things that determines airflow. We talked about this already when we talked about inspiration and expiration. As the diaphragm contracts, it pulls downward, making the space inside the lungs get bigger. The intercostals contract, moving outward, making the space inside the lungs get bigger. And when that space becomes bigger, the pressure drops, and that's creating that pressure difference between inside and outside the body. So lung pressure depends on lung volume, as I just said, right? Diaphragm and intercostals are moving down and out, making the space inside the lungs get bigger. The volume of the lungs get bigger. Higher volume in the lungs means a lower pressure in the lungs than the air outside. Lower volume in the lungs means a higher pressure in the lungs than the air outside. Ultimately, the atmospheric air pressure does not change that much. It can a little bit with weather, and it can a little bit with altitude. So if you're going in an airplane or up a mountain, right? And someone with a CPAP machine will have a change in the atmospheric pressure. But typically, there's not that much of a change in the atmospheric pressure. Most of the change is occurring inside the lungs by changing the volume capacity of the lungs. The other thing that determines airflow is resistance. Resistance is what it sounds like. It's, what's happening in the body that might cause the lungs to resist having air flowing through them. We talked about peripheral resistance when we talked about the cardiovascular system, and that was referring to the fact that certain things can make it so that it's less likely for blood to be able to flow through a blood vessel. There's certain things that cause blood to resist flowing, and this is kind of the same idea here, except air is flowing instead of blood. There's four main factors that determine resistance. One is the diameter of the bronchioles and the bronchi. Another is pulmonary compliance, which is basically how stretchy are the lungs. Another is the surface tension of the alveoli. And then the last is obstruction of the airway. Let's take a look at these in detail. First up is the diameter of the bronchi and bronchioles. The diameter of these tubes is basically mostly controlled by the smooth muscle in the wall of these tubes. So we talked about how we have these belt-like, strap-like smooth muscles that are in the wall of these tubes, and when those muscles constrict, it's like a belt tightening, and it squeezes on that tube, making the diameter inside the tube get smaller. But when those muscles relax, it increases the diameter of the tube. So when the muscle relaxes and we get the increase in diameter, that's called bronchodilation. This reduces resistance, right? The bigger tube for the air to flow through, it's easier for the air to flow, right? So it increases airflow. The sympathetic nervous system can signal bronchodilation, and this is important for things like when we're exercising and we need to get more airflow into the lungs. Epinephrine is a hormone that's also released under the sympathetic response, and epinephrine will also cause bronchodilation. Albuterol is probably a drug that you've heard of, and albuterol is a drug that causes bronchodilation, so this is something that an asthmatic might use. When those smooth muscles contract, as I said before, they decrease the diameter of the tube, and this is what we call bronchoconstriction. Bronchoconstriction will increase resistance and reduce airflow. This can be caused by the parasympathetic nervous system. So the parasympathetic nervous system is activated when we're at rest, and when we're at rest, we don't need to increase that airflow to our lungs, so we'll have some bronchoconstriction that will occur. Cold air can also stimulate bronchoconstriction. Your body does not like it when cold air is getting into those alveoli. It can damage them. So your body will react to decrease the airflow into the lungs so that we don't damage those alveoli. Certain irritants that we inhale, like smoke and things like that, that can cause bronchoconstriction. And of course, bronchoconstriction is something that's very common in asthma. In the picture here, we can see a normal bronchiole versus an asthmatic bronchiole. And you can see how in the asthmatic bronchiole, those smooth muscles are really tightened, causing that bronchoconstriction. Additionally, we have extra mucus being produced. Looks like we have a thickened wall. All of those things can lead to the problems involved with asthma. Another thing that affects airflow resistance is pulmonary compliance. And don't let that word scare you. It's just talking about how easily the lungs expand. Healthy lungs are compliant. They're very easy to expand, meaning they're very flexible. You can kind of think of them as being really stretchy, right? And that makes sense. When you're trying to blow up balloons, the stretchier the balloon is, the easier it is to blow it up, right? Those balloons that are real stiff and hard are hard to blow up. So when it comes to pulmonary compliance, the more compliant the lungs are, means we'll have less resistance and an increase in airflow. One of the main things that affects this is scarring of lung tissue. So disease or damage to the lungs can cause something called pulmonary fibrosis, which is the scarring. When we have this scar tissue replacing the other normal tissue of the lungs, that scar tissue is less compliant. It doesn't stretch as much, it's stiffer. So that increases resistance and reduces airflow. Pulmonary fibrosis can be caused by unknown things. We call that idiopathic pulmonary fibrosis. It can be caused by environmental pollutants, allergens, pathogens, autoimmune diseases, and more. One thing that we're seeing with COVID-19 is the fact that once people recover from COVID-19, some people still will have damage in their lungs in the form of pulmonary fibrosis. So that's one of the devastating things about this coronavirus, is that even though someone might get over the initial symptoms, they can have long-lasting complications like pulmonary fibrosis. Another thing that affects resistance is the surface tension of the alveoli. And this one is maybe a little bit harder to understand, so I've made some drawings that are kind of awful, but hopefully they get the point across. So both of these are drawings of alveoli, and the little blue things are supposed to be representing water, okay? So we have water lining the inside surface of all of our alveoli, because when we inhale air, there is water in air, right? And there's water in our body, so there's going to be water covering the surfaces of the alveoli. And water molecules attract to each other. When we exhale, those alveoli get smaller, and the water molecules that are like across from each other in these alveoli can attract, and that can cause the alveoli to collapse. And a collapsed alveolus means we're going to have high resistance and reduced airflow. The way we overcome this is to use surfactant. So the alveolar surfaces are coated with surfactant to reduce this water tension. So in the bottom picture, you can see I have an orange layer that's put over the water, right? And that orange layer is representing the surfactant. So think of the surfactant as more of an oily substance than a watery substance. So when we exhale and the walls of the alveolus come closer together, the water isn't going to attract to each other because it's covered by this surfactant. The surfactant is produced by the great alveolar cells, or type 2 cells, in the alveolus. And as I mentioned, this surfactant will reduce resistance and increase airflow. Premature infants may lack surfactant, and that's because the production of surfactant is one of the last things that happens in the infant's body prior to birth. So these premature infants may have a hard time breathing due to that lack of surfactant, and there are certain things they can do to increase the level of surfactant in the infant's body, especially if they know a premature birth is likely. The last thing that we're going to discuss that affects resistance is obstruction of the airways, and of course this one just kind of makes sense. An obstruction of the airway is a partial or complete obstruction that will cause an increase in resistance and reduce airflow through the lungs. Many conditions can obstruct the airways with mucus or swelling. So we talked about asthma already, right? And that's what we see here on the screen. With asthma, we have extra mucus and we have swollen bronchioles, and all of that obstructs the airway. And of course, someone might inhale a foreign object, and that will obviously obstruct the airway. Cystic fibrosis. With cystic fibrosis, someone is producing way too much mucus, obstructing the airway. And as we said, it occurs in asthma too. So just a quick recap. Airflow is determined by the change in pressure between the lungs and the atmosphere, and it's also determined by resistance to airflow. Very little will happen in order to change that pressure between the lungs and the atmosphere, but there's a lot of things that can add to resistance, such as obstruction of airways, surface tension of the alveoli, pulmonary compliance, and bronchoconstriction and bronchodilation.